All right. So apparently I am live. Cool. Awesome. Okay. This is a first. Welcome, everybody. I am Autism Fitness founder Eric Chessen, leading the movement for movement and bringing you a very special edition of Autism Fitness Tuesday training. And why am I doing this? Because the YouTube channel, Autism Fitness Workouts, has been growing and growing. And I wanted to give an opportunity for those of you who are following and might be watching to play on in with this live edition of Autism Fitness Tuesday training. As you might know, those of you who are either on the email list or are subscribed to the Autism Fitness here, every Tuesday I do the Tuesday training with another topic that focuses on a practice, a concept, a strategy, an exercise that we use in autism fitness training. And I thought, you know what, it might be cool to invite some people in to do it live, to flub anything that I will over the course of this. And then, of course, to upload it to the rest of the subscribers who couldn't be on live. However, if it works out, then I will do these live from now on and take your questions as I go along. So with that, two things. Number one, if you are ready to become an Autism Fitness Certified Pro, you can head on over to autismfitness.com, learn all about the Pro certification, the Expert certification, of course, Autism Fitness Site certification. And if you want more information on that, then we can definitely have a conversation. And the second thing is the subject of today's Autism Fitness Tuesday training, or this evening's Autism Fitness Tuesday training, because here in Charlotte it is 9:01 p.m. Going to be talking about what to do once you have your assessment. Now, this is, of course, predicated on the fact that in autism fitness programming, so our certified pros, those who we train, are using the Autism Fitness PAC profile, that's physical, adaptive, and cognitive, to assess and address physical capabilities. And of course, it goes far beyond that, which is why we have physical, adaptive, and cognitive. That is the standard operating system that we have in autism fitness in order to address the three skills that are going to be most relevant, most important, and are going to give both us and our athletes the capabilities to be successful with fitness, both in the short term and long term. So what I wanted to focus on in this particular edition was once you have your completed PAC profile, and I'll go back and I'll talk a little bit about how we assess. Once you have your assessment completed, what are we doing with that? So we have video, we have a report, we have information about an athlete, and it may be limited, it may be robust information from that first 35 or 45 or 55-minute session. So the question is now, what are we doing this? But I'll backtrack a little bit there. So in your assessment session, it is ideal in all respects to have as many of our foundational exercises assessed during that initial session. So when we're going through our warm-up phase, our power phase, and our strength phase, to go through hurdle steps and overhead band presses and walking band pulls and overhead band walks, and then go into power and have our 3 medicine ball throws, our sandbell slams, and then go into strength, squat, overhead press, push up, band row, band pull down, farmer's walk, heavy carry. And if that is the case, and all of the exercises are not even completed to standard, which is another thing we look at, whether we need to have the athlete perform the exercise at standard, modify it, or progress it. Of course, these are all things in the certification. But even just try it out so that we can get what the athlete's current baseline is. Once we have that baseline, we can understand, okay, right now, not tomorrow, not 3 weeks from now, not 3 months from now, right now, what is the athlete capable of doing with this exercise? We need to establish that baseline, because that is going to tell us what the athlete is currently able to do and how we're going to build a program around it. So let's let's suppose best case scenario right now. Awesome, super motivated athlete, goes through everything, every single exercise in 45 or 55 minutes for 2 or even 3 sets. You probably have a pretty good idea, not necessarily a perfect idea, of what that athlete's physical capability is right now with that squat or with that overhead press or with that push up or with that heavy carry, which makes it much easier to start designing the program for their next week, or for their next session, whether it's tomorrow or it's the following week. We have a good idea of where we can start. Right, so that's ideal situation. The athlete has great follow through with motor imitation. You can demonstrate it. They can do it in our autism fitness curriculum. We call that label, demonstrate, do, and cue. It is a highly successful process, and also keeps a coach from doing that dreaded overcoaching. That is often, I would say, the number one mistake in the coaching world, both for uh, neurodivergent and neurotypical individuals. So if you have all of these data points, or you have all of this observational information, of course, always recommend taking video as long as there is consent of the athlete and the family taking video of the athlete performing the exercise, because that's going to tell us a lot about their physical performance, because there are always going to be things that we miss. And I like to take from multiple angles. Side views are going to tell us what the feet are doing, what the hips are doing, what shoulders are doing, so we can go back and review that. Really important, right? If you have all of that information about every single exercise, designing a program around that is relatively easy. We look at the athlete's strengths. We look at the areas that we want to further develop strength and stability and motor planning and focus on those. And then we determine our total sets and repetitions and the resistance and the positioning and any modifications based on everything that we've seen, because we've already seen the athlete perform that exercise, which great, even especially for multiple sets. Where it starts to become a little bit more challenging from a coaching perspective is when we have an athlete who, mainly because of challenges in adaptive functioning — what are we talking about? An athlete who is less motivated, an athlete who has some off task or some distracted or some disoriented behavior. In that case, it's highly likely that there are going to be fewer exercises accomplished. And this is fine. The goal of that initial assessment session is to make sure that the athlete feels comfortable in the environment, to build rapport as a coach, and to introduce some of the exercises. We're definitely not looking for perfection. We're looking for an athlete who is comfortable and capable, because over the mid and long term, that's going to take us and the athlete a lot farther in what they're capable of doing. So we don't want to just start shoving exercises their way so that we complete every single thing and we can check it off. This is not a game of how many exercises can I check off and how many exercises can I fill into this session. It's about going with the flow, and going — what I mean by flow, going with what we observe the athlete to be comfortable with doing, regardless of whether they are able to express that verbally or whether we have an augmented or alternative communication system for them. And that will guaranteed take a while for a lot of coaches and a lot of athletes. Even when you have a highly verbal athlete, sometimes to get a sense of who they are, it's going to take a couple sessions. Sometimes when an athlete says, yes, I'll do that, they really mean absolutely not. They might be saying okay, but inside their head, It's an absolute not. And we're not always going to be able to read that in the initial session. Historically, I certainly have had first and second sessions where I've misread a cue from an athlete, or I've misread some type of facial expression, or I learn later that that athlete just needs a couple extra seconds or a minute to self-regulate before they're ready again. These are the things that we learn along the way. So we want to give the athlete that credit, and we want to give the athlete that bandwidth to be able to have their time also, and to settle in to the session. So sometimes this is a little off topic, but sometimes it makes a lot of sense to just give the athlete a little extra space, particularly in that first session. So coming back to the session where we have not every exercise completed, let's go to the opposite end of the bell curve here. We have an athlete who completes 2 exercises total in 45 minutes, and I can almost guarantee you that that is going to be not because of physical or cognitive capability. That's going to be an adaptive issue where we have an athlete who's highly dysregulated. Again, happens often enough. So in that case, what do we do as far as programming? We don't want to build 5 or 6 or 7 exercises onto those 2 that we started with. The next session is predicated on what happened, what was the baseline in the first session. So maybe we start with those same 2 exercises, and we can build in 1 or 2 more exercises in that second session. It's not always a direct linear progression, because there have been first sessions where an athlete completes 3 exercises and they're highly dysregulated, and then they come in the next week and we're able to do 5 or 6 or 7 exercises. So it's important to get a good read on the athlete's level of comfort in, I pronounced that really strangely, of comfort during that and subsequent sessions as well. So your program structure, it's 100% fine. And it should be the case that your program structure is going to be set up prior to that next session. So I like to have a very clear idea of what the expectations are going to be, what the program is going to look like, what exercises we're going to be using or trying in that second or third session, and at what level of capability, again, modified, at standard, or progressing them. However, in those first few sessions, we also want to enable for flexibility and be able to change based on how the athlete is showing up. If the athlete is a lot more calm and focused and ready to go in that second session, yeah, we can add some sets. We can add some exercise. There's an excellent time and opportunity to offer a choice, where if we're introducing 1 or 2 new exercises, we can ask the athlete which one they want to do first. And we're not going to assume that they've ever seen any of these exercises. So one of the things that we can do is introduce the exercises, again, going back to that label, demonstrate, do, and cue process, and using that. So what do I mean? Labeling the exercise, giving it a name. So do you want to do standing band rows? I demonstrate 5 or 6 or 7 repetitions of the standing band rows. Or do you want to do squats? I go and I demonstrate 5 or 6 or 7 repetitions of a squat, and I give the athlete a working knowledge, at least for a start, on what the choices are, how to perform these exercises, so they can make a more informed decision about what they want to do first, or if they have a preference one versus the other. So with all of this information, number one, in that initial assessment session, you're going to get information about an athlete's physical, adaptive, and cognitive capabilities as they relate to exercise. When you have those, you have information about one session, which is good. It's definitely advantageous over having information about no sessions. And you want to build on that whatever happened in that first session, you want to build on that in your second session. So largely based on the adaptive functioning, the motivation, the self-regulatory capability, the distraction or not distraction of that athlete, that's going to give you an idea of how robust you can make that program, meaning how many exercises, how many sets, how much break time, how much choice, using visual schedules, using text-based schedules where you're writing out the name of the exercise, the athlete is checking it off. All of these things are going to be pieces of information that you're going to utilize in those next few sessions. And that second session is often way better in terms of how much you get done, how focused the athlete is, than the first session. Sometimes the opposite can occur. Sometimes the athlete feels comfortable, but now they also are getting dysregulated because they want to explore the environment, or they at times with the coach may not have developed a rapport yet, so they're not certain what the expectations are. That certainly happens as well. So there's not 100% guarantee or accuracy from one session to the next, which is why we want to proceed not necessarily cautiously or conservatively, but we want to use the information that we have from that first session to inform how we're going to approach that second session. But again, all of this stems from using the PAC profile assessment in our first session, because checking off those boxes in physical, adaptive, and cognitive functioning is going to give us a structure for what to do next. So I hope this has been helpful for you. I think I'm going to announce that I'll be on live next week. And if you have any questions about autism fitness programming, about how it's implemented in your own programs, or anything that you got from this, definitely leave those in the comments below. And if there's a topic you'd like me to cover in a future edition of Autism Fitness Tuesday Training, leave that in the comments below as well. I'm Autism Fitness founder Eric Chessen, leading the movement for movement. Thank you very much for watching, and please don't forget to like and subscribe. And I'm ending this stream.